Welcome to Doc Talk, sponsored by Grand Itasca Clinic and Hospital. My name is Shannon Petroske. I'm a nurse practitioner that works in the oncology and hematology department at Grand Itasca. Today's Doc Talk will be on surviving cancer and caregiving. So, our first question is, who is a cancer survivor? A cancer survivor refers to any person with a history of cancer from the time of diagnosis through the remainder of their life. We used to feel that a cancer survivor was somebody who was many years out from their cancer diagnosis. Now we have come to an agreement that a cancer survivor is anybody that is diagnosed with a cancer from that date of diagnosis through the remainder of their life. Just wanted to go over some of the statistics on cancer survivorship. So the number of people with a history of cancer in the United States has gone up greatly over the last 45 years. In 1971, there were only 3 million people with cancer. As of January 2019, it's been estimated that there are 16.9 million cancer survivors in the United States. This actually represents approximately 5% of the population. About 67% of today's cancer survivors were diagnosed more than 5 years ago. Over the next decade, the number of people who have lived 5 or more years after their cancer diagnosis has been projected to increase by approximately 33% to 15.1 million. About 18% of all cancer survivors were diagnosed 20 or more years ago. And 64% of survivors are 65 years of age or older. It's estimated that by the year 2040, 73% of cancer survivors in the United States will be age 65 or older. The most common cancer that cancer survivors are diagnosed with are breast cancer, which accounts for about 23% or 3.6 million survivors, and prostate cancer is about 21%, and then colorectal cancer at 9%. Cervical, uterine, or ovarian cancers are at 8%, and melanoma, which is also at 8%. How many cancer survivors are in the US? And this is just a graph here that we have, and it kind of looks at a 10-year span. By the year 2029, they are projecting 21.7 million cancer survivors in the United States. From 2016 to 2040, there will be an additional 11 million cancer survivors in the United States. So we talk about cancer survivorship by site of cancer diagnosis. So this graph here just kind of gives us a picture of men and women divided up. For males, the number one cancer diagnosed is prostate, with over 3 million survivors. For female, we have breast cancer with over 3 million survivors as of January 2019. When we look down just below the top, we see as of January 2030, prostate cancer survivors will go up to 5 million, and breast cancer survivors will go up to 4,900,000. So you can see again, from January 2019 to January 2030, we have a great increase in the amount of cancer survivors. Why is it that we have such an increase in survival of cancer? So there are 3 to 4 major improvements in some of the testing that we do and screening tests. Mammography for breast cancer, this is one of the screening tools that has been around for quite some time. However, we recently added something called tomosynthesis, and this is like a 3D picture for mammography, which has been shown to really help in the early diagnosis for breast cancer. We also have the PSA test for prostate cancer. This is something that you should talk with your doctor about, whether or not this PSA blood test is right for you. Colonoscopy for colorectal cancer. Colonoscopy screening has found many early cases of colon cancer. Pap test for cervical cancer. And one of the new tests is a low-dose CT scan for lung cancer. So recommendations for this low-dose CT scan is an annual low-dose CT screening for adults aged 55 to 80 years old that have a strong history of smoking. They're either current smokers or have quit within the past 15 years. This is something that should also be talked about with your provider to see whether or not this is something that you should be doing. Improved management of side effects helps to keep planned treatments on schedule. So many years ago, when patients would come for their chemotherapy, they often had many side effects, and that kept them from getting their treatments on time. So now we have many different medications that can help us to manage those side effects so patients are better able to stay on schedule for their chemotherapy treatment. We also have new and improved treatments such as targeted therapy and immunotherapy. With targeted therapy, this kind of therapy targets specific genes and proteins that are involved with the growth and survival of cancer cells. So this therapy actually aims at treating those different genes and proteins. We also have immunotherapy, which helps your immune system fight cancer. There are several different types of immunotherapy out there, but we have seen really great success with these new targeted and immunotherapy treatments. Now we're going to talk about some of the phases of survivorship. There are 3 distinct phases of survivorship. The first phase is the acute phase of survivorship. This phase begins at the diagnosis and goes throughout the end of the initial cancer treatment. During this phase, cancer treatment is the main focus. We then move to the extended survivorship. This begins at the end of the initial cancer treatment and goes through the months after. The effects of cancer and treatment are the focus of this phase. And finally, there's the permanent survivorship. This is the period where years have passed since the treatment has ended and recurrence seems less likely. However, long-term effects of cancer and treatment are the focus in this phase. When we look at the acute phase of cancer survivorship, we're dealing with some of the side effects of treatment, physical discomfort or pain, and anxiety. We know that while patients are getting their chemotherapy treatment and are right in the middle of their treatment, there is a lot of anxiety. There can also be side effects such as nausea, vomiting, fatigue that we are focusing on treating and taking care of. With that extended phase, there's the fear of recurrence, recovery from acute side effects, and there is still that physical discomfort or pain associated with the treatment. When we look at the permanent or long-term phase, this is when we help patients integrate back into their normal life. Some patients are dealing with employment concerns, insurance, medical bills, relationships, even self-image concerns. There are also long-term side effects of cancer treatment that we deal with in this permanent survivorship phase. Some of the long-term side effects of cancer treatment that cancer survivors deal with. Most cancer treatments will include one or more of the following: surgery, chemotherapy, or radiation. So almost all cancer survivors will have at least one, if not all, of these treatments. With surgery, there are a few different things that cancer survivors deal with. One can be body changes. This can happen through hormones, through the treatments that we use. It can also be partly due to removal of a body part, such as breast. Patients who have a limb removed due to a bone cancer. This goes with this disfigurement, which is when we have body parts removed. Lymphedema. Lymphedema happens when lymph nodes are removed as part of cancer treatment. And what can happen is we can have swelling of a body part, such as an arm or a leg. And this swelling happens because of buildup of lymph fluid in the body. Usually the lymph nodes are there to remove that lymph fluid and help it flow. And when we take out those lymph nodes, patients are often left with swelling in their body. There's also the loss of fertility due to surgery. With many cancers, we have to remove the uterus for uterine cancer or ovaries. And so many patients have to deal with the loss of fertility. Some of the side effects of chemotherapy include toxicities of the heart, the lung, the liver, and the kidneys. There are several chemotherapy medications that are toxic or can be toxic to the heart. It is very important for us to monitor the effects of these treatments. Some immunotherapy medications, which I talked about, can actually cause inflammation of the lung or the kidneys. And so we again have to be very careful when we're giving chemotherapy medications that we're keeping a close eye and monitoring other organs in the body. Chemotherapy can also cause hematologic and neurologic system changes. So one of the main side effects that we see long-term is something called neuropathy. And what happens is the chemotherapy causes damage to the nerves. And so we see patients that complain of numbness, tingling, and pain due to the chemotherapy causing damage to the nerves. This can be long-term, and patients can suffer with neuropathy for many years. Chemotherapy can also cause hormone changes. We often treat breast cancers with different medications that can alter their hormones and change hormones. So this is something that patients have to deal with lifelong. We also talk a little bit about bone health. Certain chemotherapy medications are known to contribute to osteoporosis, so it's very important that we monitor bone health in all individuals as well. With radiation therapy, we often see skin changes and skin sensitivity. Often patients have sensitivity and burns on their skin that can cause scar tissue and damage for years to come. It can also affect the lung and the heart. There's something called pulmonary fibrosis. This is when tissue is damaged and scarred, and this can sometimes not present itself until months or years after treatment has finished. And again, we talk about the loss of fertility with radiation therapy. If a patient gets radiation therapy to the pelvic area, this can cause some damage to the tissue in that area, leading to infertility. Something else we look at is a secondary cancer or a recurrence. A secondary cancer may be a new primary cancer, or it may be a cancer that has spread to other parts of the body from where it started. It may develop as a late effect of a previous cancer treatment, such as a chemotherapy or radiation therapy received in the past. Chemotherapy and radiation therapy can also damage bone marrow stem cells. This then increases the risk of either an acute leukemia or myelodysplasia. Myelodysplasia is a blood cancer where normal parts of the blood are either not made or they're abnormal. How do we help cancer survivors heal? The most important thing that we can do is focus on meeting the needs of the cancer survivor to improve their quality of life. According to a report from the American Cancer Society, approximately 1 in 4 cancer survivors report a decreased quality of life due to physical problems, and 1 in 10 due to emotional problems. This is just a graph here on cancer survivor needs and the quality of life. So you can see the box in the middle is their quality of life. And in order for our cancer survivors to have a good quality of life, all these needs need to be met. And this is the physical need, psychological, social, and spiritual well-being. With our physical needs, we need to have symptom control of the side effects, pain, fatigue, poor sleep quality, and these affect the ability to perform normal daily activities. This affects our physical well-being. Psychological and emotional well-being refers to the ability to maintain control over anxiety, depression, fear of cancer recurrence, and problems with memory and concentration. Our social needs, this addresses relationships with family members and friends, including intimacy and sexuality. Employment and financial concerns should also be considered in this social needs. Our spiritual needs also need to be met. Our spiritual well-being is derived from drawing meaning from the cancer experience, either in the context of religion or through maintaining hope and resilience in the face of uncertainty about one's future or about one's health. So you can see that how important it is for all of these different aspects to be met in order to have a good quality of life. When people are finished with their cancer treatment, some of the common things that cancer survivors have told me is they worry about every lump, or with every ache and pain, they worry that their cancer is back. I also hear that cancer survivors say that the days leading to follow-up appointments cause great anxiety. Everyone expects me to be back to normal, but I don't know if I'll ever be. And I think this is probably one of the biggest that I hear when patients feel that they should get back to their normal and they don't know what their new normal is. So it's very important for us to help them find that new normal for them. Many cancer survivors feel afraid to be on their own when their treatment is over. When they come to the infusion center or to the cancer center to have their treatment, there's many people that are taking care of them and helping them through their journey. And when their treatment is over, many patients feel isolated and alone. After treatment is done, cancer survivors often hear people say things to them such as, "Your treatment is over and now you can get back to your normal life." Or, "You are lucky it was caught early." They also hear things like, "You are cured, so you should be happy," or "You need to be more positive." One of the biggest ones that I have people tell me they hear is, again, "Treatment is over, now you can get back to your normal life." Their normal life is not the same. And so when we're taking care of patients and if you have friends or family that have just gone through cancer treatment, it's very important that you let them get back to life as they see their new normal. Regaining and improving health after cancer is very important. Physical activity is one of the most important things to maintain the health after cancer treatment. Obesity is a great risk factor for development of several different cancers. Nutrition and maintaining a healthy body weight is very important. Smoking cessation, of course. Smoking is linked to many different cancers, including colon cancer, lung cancer, breast cancer, bladder cancer, and many others. Decreasing the amount of stress. Depression, anxiety, PTSD, fear of recurrence, all of these things cause increased stress. We need to help our family members that have recently finished cancer treatment to seek help, either from family or friends or professional help coping with stress. We also need to encourage our cancer survivors to follow up for regular screenings and exams. Oftentimes when patients are done with their treatment, they don't want to come back to the clinic. They want to put their cancer treatment behind them, but it's very important to continue regular follow-ups and having regular screening exams. Now we're going to talk a little bit about caregiving. According to the American Cancer Society, a cancer caregiver is the person who most often helps the person with cancer and is not paid to do so. In most cases, a cancer caregiver is a spouse, a partner, or a family member. Some of the common tasks of caregivers include assisting with activities of daily life, making sure that patients are transported to and from appointments, making meals for cancer survivors or cancer patients, and helping to manage finances and insurance issues. Some of the common feelings of caregivers. Many caregivers feel satisfaction. Many find that caring for a loved one enriches his or her own life and allows them to show love and respect for their loved one. They also feel great accomplishment. They may find that they have abilities and inner strength that they never realized that they had. And joy. Many caregivers feel a great sense of joy in being able to provide love, care, and support for their loved ones. During cancer caregiving, there may be great times of joy and satisfaction. However, there are also times of distress. There may be times when you feel like you've done well, and there will also be times when you feel like you can't do anymore. This is very normal. Sometimes caregiving can lead to stress and burnout. Caregiver stress occurs when you do not have enough time to do all that's required or all that is asked of you. Caregiver burnout is when the stress accumulates to a point that you are in a state of distress for a long period of time. Some of the signs of caregiver stress and burnout are when we ignore our own health needs, our diet begins to fail, we lose contact with friends and any social interactions, frequent outbursts of anger, sometimes maybe feeling resentful towards your loved one or other family members, feeling anxious, sad, depressed, or hopeless, or extreme fatigue. Some of the causes of caregiving include shifting the roles in a relationship. Sometimes there could be a situation where the cancer patient used to pay all the bills, and now that patient is too tired and the other family members have to step in and take over that, or meal preparation. So sometimes that shifting of roles can cause a lot of stress in a relationship. There's also fear and uncertainty, a lot of worrying about what the future holds. Financial pressure. If one family member is unable to work anymore due to cancer treatment, there's a lot of pressure put on the rest of the family to try to make up. Isolation, not spending time with support system outside of caregiving, and guilt. A lot of caregivers can feel guilt, feeling that they're not doing enough for their loved one. How can we reduce the caregiver stress? First of all, ask for help and accept it. Allow support from family and friends. And I think this is probably one of the hardest things to do, is to accept help that's offered. Another way to reduce stress is maintain a healthy diet and get enough exercise. Prayer, meditation, and journaling are helpful. Make time for yourself. Don't try to do it all. Make sure you set limits on what you can do and learn to say no. Attend support groups. Educate yourself and look for resources available. One of the most important ones that I skipped was seek professional help. And I think if caregivers are feeling helpless and sad and hopeless, it's very important to seek professional help. This is a picture of our new cancer and infusion center at Grand Itasca Clinic and Hospital. I hope you enjoyed this episode of Doc Talk on cancer survivorship and caregiving. Thank you for listening.